So knee positioning then, we're going to do MCL. So Zach, I need you kind of perched on the edge, slight bend in the knee for me, please. So the thing with the knee is that we've got big muscle groups either side of the knee, above and below. So for the ankle points, we do want to have some give to it, but it does need to be sturdy and secure. So for the ankle points, we're going to use EAB Tiger Club. Got a slight bend in the knee as well to make sure that he will be able to extend it. If we had a knee fully flexed, there's a good chance that you get tape caught up in the back of the knee and he's going to extend it and rip out a load of hairs and not a full extension. So there are our anchors. MCL then, the focus is going to be on the medial aspect. So right about there. So we're creating that basket weave again with the tape, and we want to try and cross over that point with every strip of tape that we use. So just like with the Achilles, the wider we start, the wider we finish, and we're going to slowly work in till the angle becomes less and less acute. Always make sure that you miss the patella as well, because that does need to be able to move independently with the tape on, and it won't if you cover it. So we'll start medial side, or even just slightly around the back. Cover that star, because that's the point we need to be covering, right on the medial joint line and around to the front. And if you end up doing this on both sides, you should have a nice little diamond around the patella. So just like the triangles on the ankle, that's how you know that you've done it correctly. Now we do the opposite here. So medial aspect, around to anterior. Now we go anterior at the top, around to medial here. Crossing where that star was, just about there, onto the ankle point. And this does the job of providing that structure for us, so we don't really need to pull it into any tension, just make sure it's straight and crease free. Next one, we start a little bit narrower in, and that angle is less acute, and we finish a bit narrower in as well, which is what gives us the basket weave. Overlap by half, cross that point, and you can see we end up slightly just inside there. Same again with the top one, building up that integrity of the tape over the target point of the MCL. I reckon we can do another couple. So we're getting as straight as we go.
So it doesn't have to leave any gap or anything?
No, not worried about any gaps, we just want those going from that angle into there. And you can finish it off with another one if you want, especially in rugby. And then tape sometimes is better, especially with the knee. If they've had a pre-existing injury, the ligaments lax. So that would be MCL. We're doing LCL exactly the same but on the opposite side. ACL and PCL, we're just going to do that on both sides. And the only difference is there might be a different focus on PCL. We're going to start more posterior. So a little bit further back around here. ACL, we might be around a bit more anterior. But by and large, it's going to look the same. Ultimately, what we're going to have is that diamond of the patella left there. So that's the first step. The second one, we need to lock it all off, and this is going to give us the general support of the EAB tear over the top. This is the one that sometimes can confuse people. It might look a mess underneath. You cover it over with this, it shouldn't look too bad. So we'll start on this same point here, making sure we cover all that tape. We're going to give one revolution round, and what we're looking to do is just to find gaps that haven't been covered to create that diamond around the patella. So there's the first one. That's number one. We're looking for number 2, number 3, and number 4. So let's wrap around the leg and see what we're left with. So we come around there, and there's the space for number 2. So we've got our first 2, number 3, and there's a little space there, and number 4, we're looking for that one. Bingo, there we go. So wrap around, try and cover any loose bits, but trying to avoid the back of the knee, because like I said, they'll get the hairs pull out and they'll be limited into extension if they need it. Lock that off, and then it might be a case over the top of that just to put some electrical tape or something just to keep it on under zero tension. So stand yourself up then, Zach. Let's have a little look at how it feels.
Yeah.
You still got movement of the leg?
Yeah, it's great.
Do I need to slide tack you from the outside to test, or are we okay?
Yeah, let's do it.
All right, so sit yourself back down again. Just to recap, this bit is fairly straightforward, I think, with the zinc oxide. It's the EAB coming around over the top. So just take it one pass at a time and just see what you can and can't do, and aim for that diamond there on the patella. Take your time with it, and it should make itself clear as to where you can and can't go.